Please be seated. Please be seated. Honorable members, the next item on the order paper is questions addressed to the Deputy President. The next item on the order paper is questions. Members may press the talk button on their desk if they wish to ask the supplementary Members may press the talk button on their desk. I wish to remind honorable members that the names of members requesting supplementary I wish to remind honorable members that the names of members the honorable the Deputy President starts will be answering the fourth as soon as the honorable the Deputy President. The first question has been asked by the Honorable B.L. Abrams. The first question has been asked by the Honorable B.L. Abrams. The Honorable the Deputy President.
Thank you, Honorable Speaker. Thank you, Honorable Speaker. The response to the first question. Our success to the first question in responding to the fight against TB. Our success calls for in responding to the fight against TB by all of us. Calls all sectors of holistic interventions across government by all of us and business. All sectors of society. This includes the National Assembly and business, which must also incorporate this includes the National Assembly and that of honorable which must also incorporate in its own program. The programs developed by the Department work of Health, the programs developed by the fight against TB of Health. We have made substantial progress TB in terms of collaborative work. We have made substantial progress with the institutions of traditional in terms of collaborative work. The South African institutions of traditional leadership participated in the induction South African of new leadership. AIDS Council of the National participated in the induction of new leadership of the National House. This followed on the National Pledge in February this year. They had made this followed on the National Pledge in December 2017. They had made the traditional leaders in December 2017 in the Eastern Cape and to lead the fight against subsequently HIV. There were engagement with traditional leaders in KwaZulu-Natal. Subsequently, to lead the fight engagement with traditional leaders in KwaZulu-Natal, to lead the fight against the World TB Day and TB was implemented in partnership with the commemoration of the World TB Day and the Provincial House in partnership with the Royal Household. This was officiated under the leadership and support of His Majesty King Goodwill Zwelithini. We are therefore planning to make a series of follow-ups with other traditional leaders and broad civil society to intensify this fight. This is an acknowledgement of the important role our traditional leaders can play in the fight not only against HIV and AIDS and TB, but to all other social ills that are bedeviling our societies. The vision of the presidency is to ensure that all AIDS councils at provincial and district levels are chaired by premiers and mayors respectively, with no delegation to lower levels. This is meant to strengthen leadership at other levels beyond the national sphere, where this has been much more visible and coherent. We'll be focusing on strengthening the capacity of provincial and district council to roll out targeted programs that are aimed at community mobilization and activism towards the fight against these challenges. As part of planning and implementation process, the premiers and mayors will be expected to sign off their provincial and district plans, which will be guiding the framework for the implementation of various initiatives. Our key interests as well as will be assessing the functionality and effectiveness of these structures tasked with the issues of HIV and AIDS, as well as fighting TB and other social ills. Thank you, Madam Speaker.
The Honorable Abrahams.
Thank you, Honorable Speaker. Thank you, Honorable Deputy President, for a very comprehensive response. Thank you. Honorable Deputy President, I would like to know, as the chairperson of SANAC, how would you be able to involve the public reps, the MPs, MPLs, councillors in the respective areas of deployment in helping to prevent TB and AIDS? Ngiyabonga.
The Honorable Deputy President.
Thank you very much. We intend circulating the plan, our national strategic plan, to all members of this August House, so that as you go to your constituency work, you know exactly the program. Now, you have got a responsibility to initiate programs in your constituency offices so that all of us will be working, singing on the same hymn book, same program, so that our efforts yields the necessary results. Thank you.
The Honorable Kopane.
Thank you, Speaker. Deputy President, the government has allocated about 40 billion to core departments for TB, HIV-A and HIV-AIDS for 2018-2019 fiscal year, for which we welcome as the Democratic Alliance. But 36 NGOs involved in fighting and reducing TB and HIV-AIDS prevalences had their funding been cut by the Department of Health. Now, Deputy President, can you please, if you are committed to fight TB and HIV/AIDS, how can the funding be withdrawn from these NGOs?
Honorable Deputy President.
Thank you very much. You'll realize that all the NGOs that are partnering with the Department of Health, with government in the fight against HIV and AIDS and TB and all other illnesses, they don't get their funding solely from government. Government, SANAC, helps those individual NGOs to apply for funding. Now, we've got different funding institutions, and those funding institutions require that as SANAC, we support each and every application for funding, so that as SANAC, we understand which NGO has been funded, how much, so that they can also account for the money that they've received. As far as our concern, all NGOs are funded. Of course, money will always not be there for all their needs, but they've got money to run their programs. Like all of us, our needs are beyond our resources. Thank you.
The Honorable Sheikh Imam.
Thank you, Honorable Speaker. Honorable Deputy President, part of the problem of HIV, AIDS, and TB is the socio-economic conditions under which our people live. In light of this, will government ensure that all role players, including social development, human settlement, water and sanitation, the police department, the justice, civil society, come together in a coordinated effort to eradicate HIV, AIDS, and tuberculosis? Particularly if you look at in many areas that people are living, there is no proper water and sanitation, there's no proper housing, and this is what is actually aggravating the situation. So will we be able to bring all these role players under one banner and work together in being able to address the scourge of HIV, AIDS, and tuberculosis? Thank you.
The Honorable Deputy President.
Thank you very much. I think that is the focus and that's the way we are structured as government. You will understand that before we talk about the AIDS Council, the National AIDS Council, that council is supported by the Interministerial Committee, which consists of more than 10 departments. Of course, we can't have the entire government, all ministers focusing on HIV and AIDS and TB. Of course, there are interventions that each and every department, those that are in the interministerial team, to support financially and in terms of their programs and activities, support the work of SANAC. Each and every role player in SANAC, whether it's business, whether it's civil society and government, all of us, we contribute in terms of our resources, human and physical and financial resources. Thank you.
The Honorable Haula.
Mr. Mabuza, the World Health Organization estimated that in 2016, 124,000 South Africans died of TB, with the majority of people dying from TB being HIV positive. A study in 2015 also found that primary healthcare workers contract TB at 2 times the rate that the general population does. This means that those who are meant to assist the sick are in fact getting sick themselves. Is government aware of this problem? And what is government doing to prevent this problem? Thank you.
The Honorable Deputy President.
Thank you very much. As government, we are aware that in 2015, cases of people that have died because of TB, they were standing at 6.5%. That was a reduction from 8.4% in 2015. Now, as we stand now, we think TB is the highest cause of death in the country. That is why we've elevated TB and the campaign to sort of try and fight this disease, because TB, it's a curable disease as long as people can introduce themselves timelessly and take the medication. So the campaign now is to go out there, because some people have never presented themselves in our facilities so that they can be tested, detected in time, and take treatment. So we want to reach out more people. We have given ourselves a target of 80,000 people that we must reach this current financial year. We are aware that TB is a cause for many of our deaths. Thank you.
We now come to question number 14, asked by the Honorable Mbabama. The Honorable the Deputy President.
Thank you once again, Honorable Speaker. On land tenure, members will be aware that Section 25.6 of the Constitution makes provision that a person or a community whose tenure of land is legally insecure as a result of past racially discriminatory laws or practices is entitled, to the extent provided by an Act of Parliament, either to tenure which is legally secure or comparatively redress. This issue of security of tenure flows from sometimes mistaken views that land under the traditional leadership is owned by traditional leaders, which is a false view. In terms of customs, it is the people who own the land. Traditional leaders are only custodians of the people's land. Because of these perceptions and at times conflicting views on who has the right of ownership on such land between traditional leaders and ordinary people, government then is seeking to address this issue in a manner that gives certainty and removes any possibility of unwarranted conflict and distortions. In this regard, the Department of Rural Development and Land Reform has published the Communal Land Tenure Bill for public comment, and the department is still considering those comments, and I'm sure at the right time, this will come to this Honorable House. The Communal Land Tenure Bill provides for the transfer of ownership of communal land to communities that occupy such land. The bill further provides for the transfer of ownership of residential portions that are currently occupied by community members to such community members. In other words, communities will have title deeds for their communal land, and members of communities will have title deeds for their residential or business portions. Of course, there are different views on this matter, and we encourage that mature engagement continue in a manner that builds our country, the alignment of thought and approach in order to produce the necessary cohesion. The bottom line is that the land belongs to the people. Through this bill, we must see it as a process that is part of our intervention as a country in conclusively dealing with the land question in a manner that leads to the development of all our people and not for the exploitation of our customary rights of the people to their land for unscrupulous ends. Thank you, Honorable Speaker.
The Honorable Mbabama.
Thank you, Madam Speaker. Mr. Mabuza, former President Motlanthe said, and I quote, "Yintoni, yintoni."
Order, honorable members, order. Order, honorable members, let the honorable member finish a supplementary question.
Point of order, Chair. Chair, point of order.
Honorable Deputy President, can you just take your seat so you are not standing all the time? What's the point of order, honorable member?
Chairperson, with respect and the manner in which we have to refer to the office of the Deputy President as a Deputy President of the country. Therefore, I want to insist that honorable members should address the Deputy President as the Deputy President. We know for a fact that we have Mr. Mabuza.
No, honorable member, that's not a point of order, really. And there's nothing unparliamentary about the way the honorable member called the Deputy President. Please proceed, Honorable Mbabama.
Mr. Mabuza, in one of his recent speeches, former President Motlanthe said, and I quote, "The people had high hopes that the ANC would liberate them from the confines of the homeland system." He further said the majority of traditional leaders are acting as village tin-point dictators. What is government's stance on giving title deeds to rural residents under traditional leadership? Because government has had 23 years to do it. When are you going to do it?
The Honorable, the Deputy President.
Well, I thought I've tried to answer that question. Let me repeat. I have said our understanding as a country is that the land under the custodianship of traditional leaders belongs to the people. Now, The bill that is coming before you seeks to enforce that. Well, after 23 years, but it's going to happen. And you'll have an opportunity as this August House to reflect on the recommendations of the panel that was instituted by the Speakers Forum to evaluate all the legislations and the impact we've made. Legislations where there are gaps, where we need to fix. Now, that report, I'm sure at one stage, you will have an opportunity to deliberate on that report, because it's a report that was meant for your ears and your eyes. Thank you very much.
The Honorable Smith.
Deputy President, in addition to the progress being made in the finalization of the Communal Land Tenure Bill, as you've just explained to Ms. Mbabane, in February this year, this House adopted a motion to have the Constitutional Review Committee embark on a comprehensive public consultation exercise on the desirability or otherwise of amending Section 25 of the Constitution, as you are aware. Can this House, Deputy President, rely on the ANC government's commitment that it views the consultation exercise as absolutely important, because the ANC continues to believe in the notion of the people shall govern, and that no decision should ideally be taken by this government that affects the people without the views of the people being heard on this important and long overdue question of the land and who it belongs to?
The Honorable Deputy President.
Thank you, Honorable Speaker. Definitely, our people should have confidence and trust in the ANC. The expropriation of land without compensation as one option that seeks to restore land to those people that were deprived or land was taken away from them, it's going to happen. It's one option. There are many options that we're going to follow in terms of redressing, ensuring that those people who work the land are given the land. Now, you will know that it's not only land that is held in private hands. We've got land that is under the leadership of the state. Different departments are holding land. Different municipalities are holding land. That land is going to be expropriated and be given to the people. Just not to lie on the land, these people must work the land. And government is going to assist those people to work the land. And that is going to happen. We must emphasize and stick to the words by the President that in all these efforts, we are going to try very hard not to disrupt the production. Instead, these efforts of trying to take land back to the people that were wrongly deprived of the land should not really disrupt the productive capacity of our country. That is going to happen, and you will be there, all of you, as we take this journey. Thank you.
The Honorable Kubisa.
Ngiyabonga Somlomo. Mhlonishwa Sekelo Mongameli, le high level panel isifikile kuthina njengoba sike sahlala sayibuka bazoyethula kuthina. Ngizwe ngoba uthi kufanele ke niyibheke. Kodwa okunye ngikubonile ngeveke edlule ngeke ngabona amakhosi abaholi bomdabu bebiza isithangami sabe indaba. Bethi okunye ipanel yakwenza yayenza ithangami zabe emadolobheni okuningi abakwazi abazilutho nje ayifikanga kubona izethulo sezaphuma kungafika kubona manje lolu daba baluzwa nje emoyeni bafunda ngale maphepheni ngabe Sekela Somlomo yini engenziwa ukuba kulungiswe lo daba labetha amaholi bomdaba abazilutho ngale high level report.
Honorable Deputy President.
Ngibonge.
Sekela Mongameli.
Ngizwile ke nami leyo ndaba ukuthi amakhosi ahlangene asho ukuthi akajabulanga ngendlela izinto zenzeka ngayo manje ke sizimisela ukuthi sibize umhlangano ophuthumayo nawo amakhosi sixoxisane ngale ndaba kanye nezinye indaba ezithinta umhlaba ngoba thina nabo kufanele sizwane ngendlela kufanele sihambe ngangishilo futhi uma ngihlangana nesilo samabandla wonke uKing Goodwill Zwelithini uma ngihlangana naye emzini wakhe ukuthi cha njengesilo samabandla ngizawufika emzini wakhe sizoxoxisana ngalolu daba sivumelene ke ukuthi sizochaza yonke into ezokwenzeka nalesiphakamiso enisenzile la eParliament ukuthi nifuna ukushukumisa iConstitution nenze isicibiyelo so ixoxa nabo amakhosi ukuthi indlela esifuna ukuyihamba yile abayizwisise ukuthi sizama ukuthi abantu abangaphansi kwawo amakhosi babe nomhlaba bawusebenza umhlaba ukuze silwe nokuswelakala kokudla silwe nokuswelakala komsebenzi siyabonga.
The Honorable Reverend Mishwe.
Thank you, Speaker. Deputy President, it is clear from the findings of the high-level panel report that for the most part, the main source of anger among landless people is not Section 25 of the Constitution, as some claim, but rather it is due to corruption among government officials that has resulted in both land restitution and redistribution going to unknown people and not those whose names are on claim forms and applications. As some of the corrupt officials and politicians may still be involved in processing those claim forms and applications, what is government going to ensure that the landless and poor people who have applied, rightfully so, for their land, are provided with direct ownership of land, with title deeds of that land, and not the corrupt officials who have the capacity to bribe corrupt officials and politicians? Thank you.
The Honorable Deputy President.
Thank you very much. I'm sure in the next 2 weeks, 3 weeks, the President of the country will announce a panel that would take forward all the land question, all the land issues and challenges. But of course, we are mindful of the issues raised in the report, alleging that there were instances of corruption in the process of restituting land back to the people. And those will be investigated. That is an opportunity that will tell us how much land has been given back to the people, at what cost, what were the processes followed, how many claims are still left behind, and what is the total cost of those claims. Now, for us to move forward, we need to make a thorough audit of what has happened and what needs to happen. That will guide our way forward as we proceed with this land question. Thank you very much.
We now come to question number 15, asked by the Honorable Dunjwa. The Honorable Deputy President.
Thank you, Honorable Speaker. Under the leadership of the new CEO and with the support of the Board of Trustees of SANAC, SANAC remains a national institution which all of us as South Africans must rally around this body in order to collectively respond to HIV and AIDS, tuberculosis, and all sexually transmitted infections. According to us, the Council is in good standing with the functional Board of Trustees, which has ensured good governance as evidenced by the 4 successive clean audits. Since the appointment of the new trustees and the CEO, the trustees and the management team have worked hard to ensure that all aspects of good governance are in place so that the funds entrusted to SANAC are properly managed and accounted for. All relevant policies to manage people, funds, and risk are in place and should give South Africans the assurance that SANAC has the capacity to fulfill its mandate. As the custodian of the National Strategic Plan 2017 and 2022, which guides the country's response to HIV, TB, and STIs, SANAC now has the responsibility to ensure that this ambitious plan is implemented through the provincial implementation plans as well as multi-sector district implementation plans, which have just been finalized and signed off. As chairperson of SANAC, the team that I'm heading is looking forward to working with all key stakeholders and leaders at all levels to ensure that we reach our goal of a generation free of HIV by 2030. SANAC is at the center of all our national efforts to contain and reverse the spread of HIV and AIDS. The CEO's role is to provide visionary leadership in driving the country's prevention revolution against the backdrop of approximately 270,000 people who are newly infected with HIV and AIDS every year. It is crucial to prioritize and upscale prevention in the same way we deal with HIV and AIDS and TB treatment. Our renewed focus on prevention will assist in ensuring that almost 48 million South Africans who are HIV negative remain so, with more babies born HIV free. As CEO of SANAC, Dr. Buthelez's major task is therefore to assist all of us to win this fight against HIV and AIDS and keep people negative from infections. We do appreciate that the pace of decline in new infection is not fast enough the way we want it. The reality is that over the years, we have not put adequate attention to prevention. SANAC will have to take major strides to address this. That is why the National Strategic Plan for HIV, TB, and STIs has placed prevention as the first goal, with the bold target of reducing new infections by more than 60% and cutting TB incidences at least by 30%. SANAC, however, cannot do this alone. Each and every South African has a role to play, and I urge all of us to throw our support behind our National AIDS Council, the new CEO and his team, as we push this new prevention revolution forward. Thank you very much.
The Honorable Tunjwa.
Thank you, Speaker. Thank you, Comrade Deputy President. In welcoming the new board and the new CEO, one wants to check if they will have the capacity and the ability to monitor and ensure that provinces do have SANAC structures, and those SANAC structures are communicating with all stakeholders in the health sector and beyond, especially communities, using pamphlets, campaigns, and material that is reader-friendly in all official languages. And how often will that happen per annum? I thank you.
The Honorable Deputy President.
Thank you very much. I don't think it is the responsibility of the new board and the CEO alone to ensure that there are structures at a provincial level, district level, local level. It is my responsibility as chairperson to ensure that these structures are there, and therefore we're going to take a program very soon to visit all our provinces. And I'm going to ensure that these structures are there and help provinces to form those structures. I'm going to help districts to form those structures. I'm going to help mayors to form those structures. For now, I have received reports in black and white to say these structures are there. They've put together their plan. Now, it's for us to meet with those structures and interrogate the plan and ensure that the plan is achievable and how often we sit together and measure progress. Thank you very much.
The Honorable Singh.
Thank you, Honorable Speaker. Honorable Deputy President, in an earlier answer you said that the responsibility of awareness lies on all of us, members of parliament, mayors, etc., etc. Yet, Honorable Deputy President, out of 400 of us in this parliament, there are probably only 3 or 4 of us that wear these AIDS badges religiously to create this awareness. And I think this is something that should be done by all of us as members of parliament to start off with. Now, Honorable Deputy President, my question is that South Africa has the highest epidemic in the world, with 7.1 million people, it being reported, that currently live with HIV and AIDS. In 2016, an estimated 320,000 children from age 0 to 14 were living with HIV in South Africa. Yet it was only 55% who were on treatment. What is going to be done by SANAC and yourself as the head of SANAC, Honorable President, to ensure that all children living with HIV are treated? Thank you.
The Honorable Deputy President.
Now, the campaign that we're going to launch now in June, the wellness campaign, the objective behind that campaign is to ensure that we get our people screened once more, those who have not been screened, so that we can enlist them in our treatment, we can ensure that they take treatment. So the very fact that you are reading the statistic to say 7.1 million people have been diagnosed to have HIV and AIDS, it's a good thing. It should not be viewed as a bad thing, because it's an indication that as South Africans, we are taking this very serious. We are presenting ourselves for screening, and we are taking treatment. We need to encourage our people to take this treatment religiously so that we reduce more infections. That is why SANAC has taken a view that let us not really deal with the problem when it has occurred. Let us put more energy and emphasis on prevention so that there's less resources, less efforts for treatment. And I'm sure all of us are going to take this message very serious so that we really deal with our behavior and how we want to fight this scourge. It is up to us. This depends highly on how we behave and how collectively we want to fight this. That is why I'm always putting this emphasis that we can't put this responsibility solely on this body, SANAC, and the role players that are there. It should be our responsibility, all of us, because it is about how we behave, how we conduct ourselves on a daily basis. Thank you.
The Honorable Haula.
Madam Speaker, Deputy President, the AIDS program and research.
I must say, you don't look like Haula. However, I see that your name is after his, so you may go ahead because you come from the same party.
Haula is my brother. Well, the AIDS program and research in South Africa reports that there are about 2,000 new infections of HIV, particularly on women and young girls. And the manifestation of gender-based violence against women is multifold. And it looks like men have declared war on women. Now I want to understand from you, as if though a fight against HIV and AIDS has been won and done, what strategy is in place, not only to deal with the attitude of men towards women and how they relate with them, but to deal with the mindset of men in order to impact positively on the gendered nature of new HIV and AIDS infection going forward?
The Honorable Deputy President.
Thank you very much. I'm sure you'll recall in the past, the former Deputy President, who's now President of the country, speaking about blessers, sugar daddies. Now, it's behind the problem that you have mentioned. If you realize more young girls are getting infected. Now, the campaign now is to try and take awareness to that group, to that level of young people who are getting abused by older men with money, with resources, abusing their poverty. That is why we are seeing the infection. And SANAC, under the leadership of the then Deputy President, raised this matter for all of us. And now we're seeing this matter on stats. Now we are reading about it, but it has been a problem that has been there. And it requires all of us to deal with this problem. I'm happy that a few provinces like KZN, like the Eastern Cape, they've got groups of girls that have organized themselves to take this campaign forward, to make aware some young girls about this problem, that they should not expose themselves for this abuse, because at the end of the day, they are the ones that are getting infected. So this is a problem. It's part of the campaign, and we are going to organize and sensitize young women. Of course, the attitude of men must change. It must change, especially older men. Older men, and I'm not very sure about ourselves yet, how we behave. I'm also calling upon you to really help in this instance. You must help. Thank you very much.
The Honorable Sheikh Imam.
Thank you, Honorable Speaker. Honorable Chairperson, Honorable Deputy President, now, something came up in the Truth and Reconciliation Commission, which seemed to have been ignored. Now, we must admit and agree that South Africa, in terms of its health sector, is quite developed in Africa. But like Honorable Singh said, we've got 7 million people affected. There are serious allegations that HIV could have been created by men to reduce the black population, particularly South Africa, to take control of our minerals and things. Now, in your Truth and Reconciliation Commission, this matter came up and there was evidence to that effect. Together with the fact that Walter Basson and his biological weapons and the dirty game that they were playing, will government consider through Senate to look into that matter so that we as the South Africans will know for sure that indeed it was either created or it was not? Because there is evidence to that effect. There are many, many allegations to that effect. And I have had many calls from people that were part of the Truth and Reconciliation Commission after I mentioned that previously. Thank you.
The Honorable Deputy President.
Thank you very much. I can see now that the honorable member is thinking aloud now. You're thinking aloud. Well, if you want my advice, I would say let's focus on the problem. It's one thing to say what is the cause and where is this problem coming from, but this problem on a daily basis is destroying the nation. Now, all our efforts probably should go towards preventing and curing this. If we can, let's find a cure for this virus. I'm not going to agree and I'm not going to dismiss your speculations, but I'm saying let's focus on dealing with the problem. Thank you very much.
We now come to question number 16 from the Honorable Adams. The Honorable Deputy President.
Thank you, Honorable Speaker. As members will recall, the expanded Public Works program focuses on 4 main areas, namely the creation of employment, creation of assets, the delivery of services, and lastly, skills development. Perhaps we must also reflect on the recruitment process. It is worth noting that participants in EPWP are recruited by the employing government department through processes determined by provinces and municipalities. For those participants who are trained through funds that are sourced by the Department of Public Works, the skills level requirements are determined by the sector education and training authorities as per the National Qualification Framework. However, for government departments, they select the required skills level that the EPWP intervention provides training on. The types of skills training in a particular project will largely depend on the skills required for that specific project. Generally, the levels of skills for the majority of EPWP participants that are trained on accredited courses ranges between NQF levels 1 up to 3. Accredited training is a requirement for training funds sourced from the Department of Higher Education and Training through its National Skills Fund. For non-accredited short courses, the participants are only required to be able to read and write. During the period in question, training was provided through skills program and artisan development programs. The skills programs provided were in plant production, public awareness promotion on dreaded diseases, child and youth care work, environmental practice, general forestry, community home building, public area cleaning, psychosocial support, etc. In the infrastructure sector, skills programs training were carried out in different areas that include painting, carpentry, plastering, bricklaying, and house electrical works. The skills transfer under the artisan development programs include auto electricians, boiler makers, diesel mechanics, electricians, filter antennas, and motor mechanics. I am informed by the Department of Public Works that during the past financial year, we have recorded training for almost 50,000 participants, which is broken down per province as follows. The Eastern Cape is 6,301, Free State is 3,907, Gauteng is 5,857, KwaZulu-Natal is 6,952, Limpopo is 4,362, Mpumalanga is 3,335, Northern Cape is 3,038, Northwest is 1,585, and Western Cape is 14,076. Thus, the total number of 18,573 men were trained. 30,840 women were trained. 6,545 young people were trained. And out of that number, 788 people were people living with disabilities. The training covered more than 300 focus areas. In terms of skills development, these figures might look positive. However, one of the critical issues beyond these processes is the proper placement of those that have undergone training in gainful employment or entrepreneurship development. Despite these recorded numbers that are contributing in reducing poverty and unemployment, there's still a need to review, streamline, and enhance the performance impact of all public employment interventions. As part of deepening the impact of anti-poverty initiatives, we are looking at how we can expand participation of key stakeholders, including the private sector, to ensure that these interventions are not only limited to EPWP. Through this process of review, we want to look deeper into how those young people that are not in employment, not in education, not in training, can meaningfully access skills development opportunities through the private sector involvement. Thank you very much, Honorable Speaker.
Speaker, on a point of order.
What's the point of order, Honorable
You know,
Member?
we heard a conspiracy theory earlier, and since then the aircon seems to have broken, the televisions seem to have broken. I'm not sure whether a virus is in the system, but perhaps you could ask someone to turn it on so we don't sweat on this side of the house in
Yes,
particular.
the IT division is already looking into it. Please proceed. I now call upon Honorable Adams to ask a supplementary question.
Madam Speaker,
Yes, Honorable.
Madam Speaker, whilst you're
Steenhuisen.
investigating the wild claims of Mr. Imam, perhaps you could check whether TV is not a CIA plot to prevent our parliament from working.
No, Honorable Member, please just take your seat. Honorable Adams.
Thank you, Honorable Speaker. Honorable Deputy President, it should be noted that 44% of the work opportunities reported in the EPWP in the 2017-18 financial year consist of youth and women, around 66%. But staying with young people, the latest quarterly labor force survey indicated that compared to adults, the unemployment rate was highest amongst the youth, excuse me, irrespective of education level. Approximately 3.1 million of the 10.3 million young persons were not in employment, education, or training. Deputy President, what is the positive impact of the expanded public works program on the youth to counter the high unemployment rate amongst the sector, especially the women and people living with disabilities? Also, Deputy President, in terms of our oversight mission as the committee, we went a couple of years to Mpumalanga. Now, the Mpumalanga Economic Development has taken those people that were on an internship in public works and they've created and give them stable and long-term sustainable unemployment. Don't you think that all government departments should be able to do that? Thank you.
The Honorable Deputy President.
Thank you, Honorable Speaker. What is a good thing that is coming out of this expanded public works program is that we have now introduced skilling and training. Maybe we need to put more emphasis on training so that our people, beyond having those short-term jobs and acquire a skill, they must be able to employ themselves or find a permanent job moving onwards. But of course, I'm happy that in the Human Development Research, Council, one priority that has been identified is to ensure that we upscale skilling. And we're looking at those young people that are not in education institutions, that are not in employment, that have not acquired the necessary education. We want to create something that will accommodate all these young people so that finally they can get training. Of course, it is important to think beyond that process, that as government we must find a way of supporting those young people that have acquired a skill to start their own small business. Now, this is an effort that we intend looking at. Well, in our previous employment in Mpumalanga, we have started something called a social enterprise development model. That social enterprise development model seeks to ensure that any work that is done by government, any contractor that does work for government, whether it's a school, whether it's a road, whether it's a clinic, we are insisting that all the required material to build a school, one condition, you must source those from the local people, so that you buy a brick there, you buy a window frame there, you buy whether a roof trestle there. Now, all those people that have been trained, your boiler makers, your carpenters are there. So source those people from the local. And I'm sure those who have taken over after us will pursue that program. Thank you very much.
Morena Matthias.
Thanks, Speaker. Deputy President.
Do confirm you're not a Matthias. Okay.
Yes, I confirm. Deputy President, the expanded public works program is nothing more than government casualizing full-time work in order to exploit the labor of our people. While claiming to address unemployment, if government wants to address the high unemployment rates in our country while also improving service delivery to our people, the best way to do this will be insourcing of all services, that is outsourcing, and fully employing those under the expanded public works program. Insourcing is less costly than outsourcing and provides the workers with better salaries and benefits. This is currently happening in the city of Johannesburg, where the city is saving money, but is also able to double the salaries of those that were previously outsourced. Why is national government not insourcing this service provision?
Deputy President.
Thank you, Honorable Speaker. Well, probably to other people that might be the way to go, but probably we can argue differently and say government, it's not an employment agency. Government must create an environment that is conducive for employment to happen, for companies to invest so that employment can be created. Why are we saying this? Because the resources that we get as government from the revenue that we collect, it's meant to go and build a school, to build a road, to provide that service, not to employ people. Employing a person, the implications are dire, because it's not just only employing that person for now. The salary of that person in 10 years will triple or will be 4 times, because every year there should be an increment. Finally, you will have your compensation of employees in government becoming more than your goods and services, the money that you must use to support these people while they are working, and there will be very little money that will be put for your capital expenses. Therefore, government will just be there to employ people that can go out and work, that can fix a road, that can build a school. So I'm not really in favor of that process. Rather, create a conducive environment for business to flourish, assist, support business so that they can employ people there. Thank you very much.
Honorable Fit.
Thank you, Honorable Deputy Speaker. Deputy President, under the expanded public works program, the reported work opportunities created in Q2 and Q3 of 2017-18 was 477,587 below target. One of the reasons given by the department for the deviation was poor record keeping by public bodies. The Auditor General noted that reported achievements were not supported by the appropriate evidence. Furthermore, the Auditor General noted clear cases of corruption where reported beneficiaries were in some cases deceased. The identity numbers of some beneficiaries were found to be invalid. Some beneficiaries were included on multiple projects when they worked on only one project. How will the Deputy President ensure that this unacceptable corrupt situation is not repeated so that the desired level and required skills transfers are achieved so that anti-poverty programs like EPWP can work as intended?
Deputy President.
Thank you very much. As government, you'll notice that we've put together a department in the presidency led by this time by Minister Nkosazana Dlamini Zuma. Now that department seeks to monitor and evaluate the impact of what we do and what we seek to achieve as government. So definitely those concerns and those allegations are going to be investigated. Whether the figures that we're getting, they are true. If there are incidences of corruption that are reported, we'll have to investigate those. We have got a mechanism that we can monitor the impact of the expanded public works program internally as government. Thank you.
All right. Honorable Sheikh Imam.
Thank you, Honorable Deputy Speaker. Honorable Deputy President, we welcome the latest stats on the number of jobs, 591,000 jobs that were created. Now, Deputy President, you know, we went on a tour, on an educational tour to Germany, and we found something very remarkable that works. And that is that BMW Bavaria, the municipality or the district, invest in a business. Will government consider getting municipalities to be investing into big business so that it's a private-public partnership and the proceeds or profits from there can go to creating more jobs, particularly in the rural areas? Thank you.
Deputy President.
Well, probably we can look at that, but what we've seen, which we're trying really to follow, also a concept that emanates from Germany, is the relationship that is there between business and training institutions that are run by government. Universities, the relationship between universities and companies. Now, students are offered an opportunity to do their practicals in companies, and before they complete their courses, already they are guaranteed of a job in a specific company. Probably that is very interesting to look at and probably to try it in our country. That there should be a close working relationship between our training institutions, our universities, our colleges, our TVET colleges with business. Now, our Human Resource Development Council has initiated that. Businesses are starting to adopt a TVET college. There's a working relationship between a TVET college and a business. Students are given a platform for their practicals, internship, and finally, probably even more prospects of permanent employment. Thank you very much.
That does with question 16. The next question is asked by Honorable Steenhuisen to you, Deputy President.
Thank you very much, Deputy Speaker. The issue of Northwest Province have been sharply raised through various voices in that province, resulting in protests that were accompanied by the destruction of property. The national government had to intervene to bring an end to this untenable situation. In cases where incidences of instability manifest themselves, any responsible government must quickly make interventions that responds to the plight of the affected communities and restore stability in a manner that promotes democratic governance. In this regard, the President has sent an interministerial task team whose work led to the invocation of Section 100 on the entire Northwest Province. In terms of this intervention, the national government resolved that the intervention must execute the following obligations. The intervention must enhance the effectiveness of internal government structures, must strengthen financial controls, governance and accountability, must implement sound financial management systems and stemming the tide of irregular expenditure, unauthorized expenditure, and accruals. Enhancement of supply chain management systems, improvement of contract management systems, the restoration of sound labor relations between government as an employer and trade unions, especially in the health sector. The task team is implementing the necessary interventions intended to resolve issues and restore normality in the Northwest Province. Reports on progress will be made to Cabinet on a fortnight basis in line with the interministerial task team mandate. The recent report was tabled to Cabinet on the 23rd of May, and Cabinet was satisfied with the progress in stabilizing the province. Cabinet then increased the members of the interministerial team with the addition of ministers of basic education, public service and administration, human settlement, social development, environmental affairs and transport. The IMC was asked to do further work in the province and advise Cabinet on which of the provincial departments should be placed under Section 101A or Section 101B of the Constitution. As a result of this work, Cabinet has approved that 5 of the provincial departments should be placed under Section 101B. And these are the Office of the Premier, the Department of Community Safety and Transport, Department of Basic Education and Sports, Department of Health, and the Department of Public Works and Roads. 5 departments are to be placed under Section 101A, namely Finance, Department of Local Government and Human Settlement, Department of Rural Environment and Agriculture, Department of Social Development, and Department of Tourism. Furthermore, the JCPS cluster is to conduct further investigation where cases of maladministration and corruption are suspected. Consultation with the provincial government is an ongoing process, and the team is there, it's working. Once the final report by the team has been presented to Cabinet, remedial actions will be taken and implemented. The bottom line is that services must be delivered to the people of Northwest in an effective and efficient manner as expected by citizens from their own government. Thank you very much.
Honorable Steenhuisen.
Thank you very much, Deputy Speaker, and may I take the opportunity to welcome the Deputy President back from Russia. Hope he had a great trip, and it's more from Russia with love than Gorky Park. I think that we have seen the reasons, and thank you very much for the answer. But I'm sure that the Deputy President would have, since his return to the country, have seen the municipal outcome of the audit reports that were tabled by the Auditor General. And what it shows very clearly is that the dysfunctions, many of which you mentioned today, particularly at local government level, are far more prevalent in the Free State, where the report recommends a 100% intervention in those municipalities, are far in excess of what is present on the ground in the Northwest, and that the state of hospitals and governance in the Free State province are far worse than what we've seen in the Northwest. And I certainly hope that my honourable friend is not indicating and incentivizing people that if they want to change in their government, that they need to resort to acts of lawlessness to get government to listen and act. But I think that the question I want to ask is that it's very, and the comment I want to make is that it's very clear that the new dawn is brought down the sunset on a key internal ANC factional political opponent in the form of Mr. Supra Mahambapelo, and yet has failed to act against the Premier of the Free State, Mr. Ace Magashule, who also happens to be the Secretary General of the organization of the Deputy President. So what assurances can the Deputy President give this House that these Section 100B interventions are not political interventions dressed up and cloaked in the respectability of a Section 100 intervention?
Honorable Deputy President.
Thank you very much. I think the situation in the Northwest, as it was discussed in Cabinet, many views were presented, but the bottom line was that national government should come closer to provinces. There should be a way that would give us an early warning system when things are not going right. Now, Cabinet decided then to identify especially health, so that national government should be proactive to look at health departments in all our provinces, including the Western Cape, so that we are fully prepared and we can prevent certain collapse of services. We intervene timelessly. So probably the Free State will fall into that category. We're not going to witch hunt, but where there is a collapse of services, definitely in the interest of the people, government must intervene, irregardless who is involved. Now, in the Northwest, the decision to place the entire government under Section 100, either A or B, it's an indication that some governance systems have collapsed. Now, that has been, it's not a speculation. It's not a speculation, it's evidence that was detected by the team that was sent there. Now, government had to really do something in the interest of the people. So I'm quite satisfied about the intervention government has made. And of course, you'll realize that the president of the country and the president of the ANC had a discussion with the premier to say, in the interest of the people, I think as premier, you have to step aside so that we try and fix this thing. And the premier accepted. And we want to thank the Premier for recognizing the will of the people. Because we hear all of us not on our own. We represent the people. And if people are showing some dissatisfaction about our leadership, we must step aside. That's it. It's not. Let me help you again. I'm going to be patient with you, and I'm going to say, please don't disturb me. I won't say shut up. I won't say that. But I'm saying, a team was sent there.
Point of order.
Yes.
The Honourable Minister of Small Business Development has just screamed across the heart, "Shut up, little boy." I would suggest to you that that is unparliamentary, as has been ruled before. and she must withdraw that.
Yabona ke ufuna ukuphendula
Honorable
wena.
Minister.
Honorable Chair, yes.
Honorable Minister.
Udakwa umbuso wena problem.
Honorable Minister, wait a minute.
Yeah, udakwa umbuso.
Honorable Minister, did you say what he said?
Honorable Chair, you can go to the Hansard or whatever needs to be to find out whether I did or not. I stand here and I say to you, he's got issues that I don't have. I never said what he said. The problem
Okay.
yakhe udakwa umbuso.
Honorable members, we will check the Hansard to confirm what was said and we'll come back. Go ahead, Honorable Deputy President.
Well, thank you. I want to answer the question. Please don't be distracted. Let's talk. Let's talk. I'm saying the progressive intervention that was done by government was informed by the material condition on the ground. Remember, firstly, that government took a decision to send military to go and assist in hospitals. That was the first sign that there's a problem in the Department of Health. And beyond that, a team was sent to go and look at the situation, and the team came back with few recommendations, and government took the first decision to place the Department of Health under Section 101B. On further investigation, then government took a decision to place a certain number of departments under Section 101B and certain departments under Section 101A. So I'm saying this decision by government was informed by the material conditions prevailing on the ground and the very fact that service delivery was hugely affected. Thank you very much.
Honorable Tlowama.
Thank you, Honorable Deputy Speaker. Honorable Deputy President. Honorable Deputy President, what is happening in the Northwest? It is a political armed robbery. What guarantees do we have that Northwest will not be handed over to another faction of thieves? By the way, did you excuse yourself when the cabinet took a decision to place Northwest under administration? Because Mr. Maumapulu is your own twin by deeds. Otherwise, this process will be like thieves chasing thieves.
Deputy Speaker.
I haven't heard the question.
Deputy Speaker.
I just heard thieves chasing thieves.
Honorable Deputy
I didn't
President.
hear the question.
Honorable Deputy President, please take your seat. Yes, Honorable Member.
Rule 92, Honorable Deputy Speaker.
Yes.
Definitely, the Honorable Bloma is casting aspersions and on the dignity of the Deputy President, and I think it's an unfair question, and that the Deputy President may not be expected to respond at all. If anything, Mr. Bloma ought to withdraw that question. Thank you. In the manner it was couched.
Yes. Honorable Tlowama, just rise to the occasion. Yes.
I'm listening, DP.
No. The DP is sitting. It's me asking you to rise to the occasion. The language you use has crossed the boundary of acceptability.
Honorable DP, this is National Assembly, not an occasion.
Not what?
It's a National Assembly, not an occasion. What I was saying is that...
No. Honorable Member, I didn't ask you to repeat yourself. I asked you to withdraw your remarks that have correctly been identified as crossing the boundaries of acceptability.
No, Honorable DP, I said...
Honorable Member, I didn't ask you to repeat yourself. I said withdraw.
What to withdraw?
Yes.
What?
You withdraw the offensive remarks you made about the deputy president.
Which remarks, sir?
You know
Which one?
exactly what you said, honorable member.
DP, you have a problem with me. Always when I stand, you act this way. You must be specific to me. What remark?
Honorable member, you also assume that by saying the things you say that you know are not parliamentary, you can get away with it from me, and you are not going to do that.
Honorable Deputy Speaker, I said at the end.
Honorable member.
Otherwise, this process will be like thieves chasing thieves. I've never mentioned the name of the DP.
Honorable member, you see, you are selectively reading your own remarks, and I ask you to withdraw them.
No, Honorable DP, I'm not going to withdraw.
Okay.
All I'm asking you is that.
All right.
Educate me.
No.
Tell me what is it that I must withdraw.
If you say to me you're not going to withdraw, then there's no conversation between us.
Honorable DP, your job as a DP is to educate me where you think I've made a mistake. I'm giving you that opportunity to do so. You can't just say to me withdraw. I don't even know what you are talking about.
Honorable member, the remarks you have just quoted are part of remarks that you made with assertions about the deputy president. And this is why you made the analogy you made. And I'm saying it is unparliamentary, casts aspersions, and you must withdraw it.
Honorable DP, I'm not saying I will not withdraw, but you are general. If you can just be specific from what
I'm not
I've
going
said.
to repeat. I'm not going to repeat the language you used, which is unparliamentary. I'm asking you to withdraw it.
Do you want me to do it in Northern Sotho because you seem to have a problem with English?
In any language, withdraw it. I have no problem with you. I have problems with your language that you know is unparliamentary, and I made no regrets about that.
Honorable DP, mark my word, I'm not going to withdraw this.
Okay.
I'm not going to withdraw it. It's
There's a
true what
door,
I've said.
honorable member, there's a door next to you there. Just use it quickly. No, honorable members, you are not the ones responsible for that. I am. Just take it easy and keep your cool, please. Keep your cool, honorable members. Honorable Kawama, leave the house. Order, honorable members, order. Honorable Sitole, it's your turn, sir.
I'm sorry,
Deputy
Honorable
Speaker.
Deputy Speaker.
Yes, Honorable Steenhuisen.
May I address you in terms of Rule 26, if I may?
Yes.
Deputy Speaker, Rule 26 says that you've got to act fairly and impartially and apply the rules of the House with due regard to the participation of all members of the House. And I want to ask you, sir, given the ruling that you've just made, why does an ANC minister like Honorable Zulu get away with what she does, but members of the opposition are constantly chased out of the House? This is a violation of the rules of Parliament.
Okay,
And you're
take
not
order,
acting
Deputy
fairly.
Speaker.
She can say what she likes, but
Order,
anyone in the
Deputy Speaker.
opposition can't say what they
Honorable member.
Order,
Deputy Speaker. No, honorable members, can you hold on? I'm speaking now. And when the presiding officer speaks, you take your seat. Honorable Stasian, you are misrepresenting the truth. In the first place, I asked the minister whether she said that. It is usual in the House when the minister, as she did, said she didn't say it, that I must check Hansard. That's fair. I asked him to withdraw his language. What did you want me to do differently? I'm acting fairly and according to the rules. I will, of course, chase her out if it proves out to be right. I'm not going to do it because you say it, Honorable Steenhuisen. I'm acting fairly and so on. Let's proceed, honorable members. Honorable Stolle. No, it's non-existent story you are painting there, honorable member. It's a figment of your imagination. Go ahead, honorable Stolle.
Honorable Deputy Speaker.
Order, honorable Steenhuisen. And please, can you allow the House to proceed without you constantly heckling? Kubeka Baba.
Thank you very much, Honorable Deputy Speaker. It's Ngwezi, not Sitole. I'm sorry.
Sorry?
Honorable Deputy President, the IFP welcomes the implementation of Section 100 of the Constitution in the Northwest. But our concern is that when the events that has taken place in the Northwest recently happened, there were early warning signs. Political parties have warned national government that there are problems in the Northwest. I mean, whistleblowers have warned this House, and the national government did not listen. Now, again, Honorable Deputy President, we are warning you in this House that there are problems in the Free State, there are problems in KwaZulu-Natal. Are you still going to wait? Are you still going to wait for people to damage properties in those provinces for you to implement
Honorable
any
Member,
investigation
your time
or
has
Section
expired.
100? Thank you.
Honorable Deputy President.
Thank you very much. I want to take that warning serious. But the warning must be explicit. Please, can you do that? I don't say do it here, but I want to hear that warning so that I take you serious. You see, next day you will say, I warned you. But that was the only way to say, I'm warning you. Tell me this and this and this and this is going to happen. Put it in writing. You can give it to me. That is a warning that probably I will take. Thank you.
Thank you.
Honorable Speaker, may I address you?
Yes.
May I address you, Honorable Speaker?
Yes, Honorable Member.
Honorable Deputy President, with due respect, the Auditor General has released...
No. Honorable Member. No. We haven't adopted a different rule so far. You've asked your question. It's been responded to. Sorry. No. Honorable Kubisa. Oh, Kathleen, I guess to learn. Honorable Sengwa, I can hear you loudly from where you are sitting. Give us some space. There's a member on the podium who would like to respond to members' questions.
No,
thank you very much.
Thank you very much, Deputy Speaker.
Thank you.
Honorable Deputy President, there have been reports in the media and in the public domain about the state of health in Northwest. For instance, it was said that women who had given birth were caused to sleep in one bed and there was no cleaning material at all. Do you think that this situation will be urgently attended to with the intervention that has been made?
Deputy President?
Definitely, and you will be aware that the Minister of Health has been there physically himself, visiting hospitals, seeing the conditions and the way patients are in those institutions. So definitely we're going to respond. Probably it will need extraordinary measures. In fact, even outside the capacity of Northwest to deal with these problems. But we're not just going to go there and see this problem, observe them, note them. These problems are there to be resolved for the sake of our people. Thank you.
Thank you. Honorable members, we go to question 18, asked by Honorable Mente to the Deputy President.
Excuse me, Deputy Chair.
Yes.
I'm going to do the follow-up question for Honorable Mente.
Okay, thank you. That's giving us notice. That's fine. Thank you. Honorable Deputy President.
Thank you, Deputy Speaker. The diagnosis of HIV is made using a rapid diagnostic test which comprises 2 point of care diagnostic tests. The first test is followed by a second test using a test kit produced by different manufacturers as a confirmatory test. The use of 2 rapid tests obviates the need to send bloods to a laboratory far away for testing. This means that within 15 minutes, a patient can be informed if they are HIV positive and be offered a treatment. This process applies to patients in all provinces, both in rural as well as urban areas. In cases where ELISA is the enzyme immunosorbent assay, results are needed for diagnosis. The turnaround time there is about 48 to 72 hours. So clients are usually requested to return to the clinic within 3 or 4 days for the results. Like I said, ELISA is a test that detects and measures antibodies in your blood. This test can be used to determine if you have antibodies related to a certain infectious condition. Delays in treating patients living in rural areas may only occur in instances where patients are diagnosed for other conditions other than HIV and AIDS. In this case, blood will need to be sent from a clinic to an off-site laboratory. Even in rural areas, most district hospitals have on-site laboratories. Very advanced tests, such as drug sensitivity tests, are only performed at reference laboratories. This is because they require very specialized machines and personnel. To optimize the use of limited resources, it was not making economic sense to have them in every district, as the number of samples usually tested at district levels are very fewer. When it is necessary for bloods to be sent to laboratories far away from the health facilities, which is usually a clinic, blood specimens are collected daily from the facility, transported by vehicles to laboratories, and the results is sent back to the referring health facility. This process does not take time and does require that a patient come back in less than 72 hours. That is 3 or 4 days. However, this is not the case for the diagnosis of HIV as it is described above. The test kits, you get your results there and there. Of course, much more still needs to be done to improve efficiencies in the provision of treatment. Where there are challenges within the provision of drugs, we will welcome that honorable member highlight such specific areas so that as chairperson of SANAC, we can attend to such issues urgently so that lives of the affected people are saved as speedily as possible. Having said that, I must point out that our struggle should be more on prevention so that we deal with the incidences of new infections. In actual fact, in the last SANAC Interministerial Committee meeting, there was agreement that an increased focus should be placed on prevention to reduce new infection. All of us have a role to play in this regard. We are confident that we'll be effectively dealing with any prevalent challenges if we can focus on prevention. Thank you very much.
Thank you. Honorable Paulson.
Thank you, Deputy Speaker. Deputy President, I hear you, but there's a huge disparity because students at higher education institutions continue to face high levels of HIV infection. And the difference between a higher education institution in a rural area and in an urban area is that the higher education institution in the urban area has easier access to testing and better facilities to do the testing and a quicker response, and in fact, in most cases, in fact in all cases, it's right on campus. But what about the FET colleges, especially those in rural areas that do not have these facilities and would have to leave campus and would probably delay, and the sooner HIV is detected, the better. So what are we doing to address that particular issue?
Deputy President.
Well, the question was that there's a time lapse, there's delay. A person will present himself or herself, blood will be taken, and it will take long for the results to come back. And we're sort of differentiating the two, that for HIV and AIDS testing, that is done on the spot. 15 minutes is enough, you'll be knowing your results. But for other diseases, definitely your blood will be taken to a laboratory where you need specialized people, specialized equipment, but that you'll be allowed to wait for 3 to 4 days. Then you are advised to come back and take your results. So I was responding to that question. But above all, I'm saying it is the duty of our people, as we made them aware, to go and test, screen themselves. That is the campaign that we're going to launch. But we're saying, dealing with the problem, it's not enough. Let us try and prevent these incidences from happening. But still, we want to encourage our people to go and screen, test. And as you test, you get your results there and there. As you test for HIV and AIDS, you can come back with your results. You don't need to wait.
Honorable Buthelezi.
Deputy Speaker, I must say that the Deputy President didn't answer the question.
Honorable Member. Honorable Member.
He never answered the question.
Okay. All right. All right. Honorable Member, take your seat. We've heard you. Yes.
It's a follow-up question, Deputy Speaker.
Sorry. Honorable Member is the next one. We'll follow that up.
Well,
Yes.
I'm happy to
engage.
To answer the question.
Honorable Buthelezi.
And now, if the Deputy Speaker can allow us.
Okay.
But if not, we
He's
can.
being very nice.
Take a seat, Honorable Member. The Deputy President will respond later. Honorable Hlengwa, please go ahead. We can't allow that.
Thank you very much, Honorable.
I've said so.
Deputy Speaker. You're speaking about other diseases being 3 to 4 days, but I put it to you that one of the other challenges with the lack of facilities is the fact that for people who are drinking and driving and then are caught, one point in case being one soccer player, Andile Jali, is that his court case is going to take place almost a year from now because there's just not enough capacity with the testing. So the 3 to 4 days is also a very gray area. But what I wanted to ask you, Honorable Deputy President, is the building of capacity and infrastructure in the health institutions in general, because the issues being raised today are just a symptom of the problem. Look at KZN, for example. The oncology department has collapsed in the whole province because there's no resource and infrastructure. So the question then becomes, what are the practical steps being taken to ensure that our hospitals and health institutions are fully functional, fully resourced, so that they can actually stomach the demand which is there, so that our patients can receive the quality health care that we so desire.
Your time is
Thank
expired. Honorable Deputy President.
Thank you very much. I think you're correct that the capacity of our health department is sort of challenged. That is to be accepted, given the history where we come from. As we speak now, departments of health in different provinces are still continuing to build clinics. Year in, year out, a department must budget for a new clinic in that community, We're budgeting for hospitals, we're still building hospitals. Remember that the kind of health service that was provided in the past was meant for few people. Now we're allowing everyone to use our facilities, and these facilities were not there. You know for a fact yourself, right? Progressively, everyone is going to receive this service. Day in, day out, there's a new hospital there, there's a new hospital. Training of professionals I don't know how many of our students are all over the world training as doctors at the expense of this government. Now, there is a complaint now that there's a shortage of doctors. We're quite aware of that. Hence, there's an effort of this government to send people outside to go and study and train as doctors. A number of them have returned back, qualified, they are in our institution, but it's still not enough. So the damage that was done in this country is very huge. You can't take it for granted that overnight it can just be resolved. It's good that probably you are sitting on the other side, you are in opposition to this government of the ANC, but the truth, me and you, who grew up in rural areas, you know it very well, where we come from. Thank you very much.
Honorable Mahlalela.
No, thank you, Deputy Speaker.
Honorable members, you can't be throwing at each other that language. You're out of order in the first place. There's a member speaking there, and you're cross-firing here. It's out of order. Order, order, I didn't invite it. Please, go ahead, honorable member.
No, thank you very much, Deputy Speaker. Deputy President, beside the challenges that the Honorable Deputy President has reflected upon, recent research has shown that there are other barriers to men testing, such as their reluctance to test because of the misguided notion of seeing health facilities being women's place, as well as their unwillingness to be queuing outside testing facilities. Are there any plans by government to address this perception by men? If so, what are those plans? If not, what will be the Honorable Deputy President's response to this perception? Thank you very much.
Deputy President.
Thank you very much. I think this question of stereotypes that emanates from where we come from as people, our cultural upbringing, this has been identified. And for a long time, we've been talking about circumcision. And we realized we're not making headway until we had to sit down with traditional leaders and they have accepted. And we're seeing a difference in KZN. Men are coming forward to be circumcised because the king is leading the church. So these are some of the stereotypes that we must probably try and speak to those who can be listened, who are custodians of culture in those communities. The very fact that the department, SANAC, has identified the role of traditional leaders, partnering with traditional leaders, in a sense, seeks to deal with those stereotypes that emanates from where we come from as people and our beliefs. I don't know whether I've assisted the honorable member.
Yeah. Honorable Wilson, don't invite him, Deputy President. Honorable Wilson.
Thank you, Chair. Deputy President, our hospitals and clinics are well known for having massive shortages of medicine and crucial medical equipment. It was recently revealed that at least 18 clinics and hospitals in Limpopo were with HIV testing kits after months of shortages of the HIV diagnostics. Now, a rape victim only has a 72-hour chance to prevent themselves from getting infected with HIV and for them to access the post-exposure prophylaxis. But they have to be tested. The reality is that rape survivors cannot get preventative treatment because of the shortage of HIV testing kits. What is the reason for clinics having such shortages of HIV testing kits? And why is this government not monitoring it properly? What will be done by this government to ensure that it no longer fails our citizens and ensures that all clinics and hospitals are fully stocked with HIV testing kits and other medical supplies? You cannot
Honourable
keep
member.
failing the people. Thank you.
Yeah, Deputy President.
Thank you very much. We'll try and investigate that because each and every day we're told in that hospital, in that clinic, there's no medication. We do a follow-up only to find that there is medication. So I'm interested, really, not to really dismiss this question. Beyond this meeting, we want to follow this. These few clinics that you're speaking about, where there are no testing kits, it must be followed because it will defeat this campaign that we want to take. If we're saying we want to take this campaign, people must present themselves to screen, and we don't have the facilities and the testing kits, we're defeating ourselves. So it's important to ensure that we have those testing kits if we are to succeed to get our people to screen. So what I'm trying to say, if we can get that information about those clinics that don't have and frequently get run out of these kits, we want to understand why. It will help us to detect the problem so that as we roll out this campaign, our institutions should be ready to handle the people that will present themselves there. Thank you.
Honourable members, that concludes questions to the Deputy President. I do wish to state that Honourable Paulson, specifically to you, if you still feel that in what the Deputy President said here, your question has not been answered, please supply it in writing. He will definitely respond to it. I thank the Deputy President. Thank you, sir. The Secretary will read the 9th to the 11th order together.
Consideration of report of Portfolio Committee on Labour and Basic Conditions of Employment Amendment Bill. Consideration of report of Portfolio Committee on Labour on National Minimum Wage Bill. Consideration of report of Portfolio Committee on Labour Relations Amendment Bill.
I now recognize the Honourable Chief Whip of the Majority Party.
Honourable Chair, I move that all the reports be adopted by this House as one. Thank you.
The motion is that the reports be adopted. Are there any objections? No objections. There being an objection, I now put the question. Those in favor will say aye. And those against, no. I think the ayes have it.
Chair, please note the objection of the DA. Thank you.
Okay, we'll note the objection of the DA.
The EFF would like to make a declaration.
No. There's a debate, there's no declaration here.
No, the EFF wants to make a declaration, Chair.
No. Order, honourable members. No, honourable member, as I suspected, in the event of a debate following immediately on the heels of adoption of the report, the usual practice is that we don't have declarations as well.
Chair.
So let's move to the next one here.
Chair,
Debate,
the,
yes.
the EFF would like to make a declaration as per the rules. You see, we are entitled to make a declaration to any adoption of the bill. So we want to make a declaration, please. If ANC does not want to make a declaration, EFF wants to make a declaration.
Honourable member, it's a report. It's the reports. The debate is on the bills. I'm trying to persuade you. I realize what you are asking for. I'm saying the practice is that where there is a debate after the adoption of a report, we don't normally do the declarations, honorable member.
Chair, the mandate of my caucus is that the EFF must make a declaration. So you cannot persuade me. I'm telling you that we're here to make a declaration on the amendments of the bill, of the labor bill.
Let me come back to you. Yes, yes. Honorable Khawula, I'd like to persuade you to do your declaration in the debate. Please. I'm making that call for reasons that the bills are going to be debated. So on the report, I request you that you take that.
You're going to add time.
Sorry?
You're going to add our time.
The practice is that the allocation of time is as usual. Yes, as you understand it, sir. It will not be end. Can we proceed, please? Let's move on. Thank you very much, sir. Please accept my ruling. I plead with you. Yes, okay. The secretary will read the, where is this now? The secretary will read the 12th to 14th orders together.
Second reading debate, Basic Conditions of Employment Amendment Bill. Second reading debate, National Minimum Wage Bill. Second reading debate, Labor Relations Amendment Bill.
The Honorable the Minister of Labor.
Thank you, Deputy Speaker, Deputy President, Ministers and Deputy Ministers, honorable members. The national minimum